Still on the prostate problems, we are going to handle PSA, the prostate specific antigen. Welcome to the Health and Wellness Spot. This is Dr. Lewis Muchile. Now, we talked about PSA, the prostate specific antigen, on a live. We explained it, we explained its relationship and the reasons why we actually do lab tests for PSA to actually monitor therapy in people who have cancer. However, this is a general overview of what PSA is, what can actually cause an increase in PSA, and what can actually cause a drop in blood levels of PSA. And then you already understand that PSA is not an indicator of prostate cancer. So if your PSA in blood is going beyond normal levels, do not allow the health systems or the practitioners to sell you the fear that you are in danger, you need your prostate removed, or you have prostate cancer. It is not an indicator of a problem in cancer. Okay, we have to do more tests, the biopsies. There's another one that we talked about on the previous live, so you can actually watch that live to enjoy it and learn. So there's a lot involved in cancer, prostate cancer. And again, prostate cancer is a slowly progressive disease. Goes slowly. The progression is very slow. So therefore, there's no call for alarm for this one. And most people who actually die from prostate cancer, most of them, about 85%, don't die from the prostate cancer itself. They die from other conditions because they are elderly. So they might die from diabetes, the complication of diabetes, hypertension, the strokes, and even the heart disease. But of course, because we have a risk of cancer, because there is cancer already involved, we classify them totally as people who have suffered from the cancer. So therefore, always be very keen before you diagnose somebody. If you're a healthcare practitioner, be very keen before you diagnose people with prostate cancer and before you sell them the fear just because of a PSA. Now, to it, PSA is prostate specific antigen. What is this? It is basically an antigen, and you know very well, antigen means a protein. So this is a protein that actually, so if you see that antigen, there are two things involved. We have antigen and then we have antibody. So an antigen is a protein that will activate the system to produce antibodies against it. Remember, antibodies are your immune cells, the army that your body produces to actually help you fight different things in your system. And even microorganisms, the bacteria, the viruses, all of them can be classified as antigens because they trigger the body to produce antibodies or immune cells against the antigen. So an antigen is basically just a protein that triggers production of immune cells that can actually destroy it. So this is an antigen or a protein that is specific to the prostate gland. That tells you if somebody does not have the prostate gland, they will not produce the PSA. However, PSA is very necessary. It has its clinical advantages and significance, and also it has its physiological significance. So physiological significance is what it is actually intended for in the body. The clinical is actually the lab tests and all that. So this is a sketch of that system, the urinary tract system. So we have the ureters coming from the kidneys, draining into the bladder, and then we store urine in this bladder for quite some time before we release it out through the urethra. Now, the urethra, as you see, goes through the prostate gland. So this is the prostate gland that surrounds the urethra. This tells you if we have this prostate gland enlarging, so if it's enlarging, it's actually going to press on to the urethra, and now the urethra diameter starts to narrow. When it starts to narrow, we will have difficulty in passing urine. This is the reason why when people have an enlarged prostate, they end up having a difficulty in passing urine, and they are given that drug, either alfuzosin, or all the drugs that are alpha-2 receptor agonists. So what they do is they actually relax the bladder muscles. When they relax the bladder and the urethra muscles, you ease up the bladder easily. You pass urine softly. Okay, so that's the mode of action. But you've seen if this is enlarging, this one is narrowing. So therefore, what is causing an enlarged prostate? That is not because of the PSA. An enlarged prostate is caused by multiple factors, and we just talked about the estrogen. We talked about high insulin levels. We talked about the high glucose in the system, the diabetes, of course. All this, including inflammation, can actually cause the problems in the prostate. Now, this is another image that will show you the bigger picture of the prostate. So in our blood, we are supposed to have the least amount of PSA, okay? Because PSA is produced in the prostate gland, and one of its functions is to actually liquefy the sperm to make sure that the viscosity of the sperm is optimum, liquefy the sperm so that the semen and the sperm comes out easily. So therefore, its physiological advantage is to improve fertility and to liquefy the sperm. So it has a very good advantage here. On clinical levels, we want to see how much of PSA is in blood so that we can actually relate that to either an enlarged prostate, an inflamed prostate, drugs, or prostate cancer. So all those are multiple factors that can actually cause an increase in PSA in blood. However, let's go back a little bit. So anything that is going to cause this integrity of this prostate gland to be altered, the barrier, will cause a release and a leak of PSA from the prostate gland into the bloodstream. Okay, now remember, PSA is produced in the prostate gland and is stored there for its functions. But when you cause a leakage, when you cause an integrity destruction, integrity of this barrier being destroyed, you cause a leakage of PSA from the prostate gland into the bloodstream, and now the levels of PSA in blood starts going up. Understand that the normal levels of PSA in blood are supposed to be below 4 nanograms per ml of serum. So if you are below 4, you're safe. If you have 10 and above, you need to actually start editing your diets, doing different lifestyles, and also go for checkups, multiple checkups. If you have 20 and above, this now is a risk for basically prostate cancer. And you have to actually take keen and go and visit a health, either urologist, to just do a checkup and then be advised appropriately. But most people come with PSAs of 20, but just very few dietary modifications and fasting, their PSA falls back to normal levels so fast. And then you start asking yourself, why was it a call for alarm? Because they come in panicking, thinking that because their PSA is very high, possibly they have a risk of cancer or they have cancer already. And when you just tell them, you know what, your PSA is super high and this requires a biopsy, these people will get into panic. They'll spend a lot of money trying to find solutions. Go to herbalists, start reading different journals, just make sure that they have information about PSA and the prostate cancer, and they end up being miserable. So they will sell their land or their animals, just come and afford the biopsies, which therefore, which later might actually be confirmed to be no cancer at all. It's a negative test. So most false positives in this PSA test are actually recorded. About 65% of the PSA tests and the biopsies that are done actually confirm these are false positives. So be very cautious about that. And for those people who are just normal, if you're just leading a healthy life, there's no call for alarm, there's no problems in urine passage, there's no need for you to go and do a PSA test all the time. Because whatever you're looking for, you might end up getting it, and it might not be a very good result. So we are leaking PSA from the prostate into the bloodstream. We start raising blood PSA to above 10, 20 or so, and now that becomes a risk. So now when you take a blood sample or a serum sample and we run it through a PSA test and we find these levels are going super high, we start telling you, oh, you know what, there's now a call for alarm and you need to actually change your life. But I've told you that an increase in PSA in blood does not automatically indicate that you have prostate cancer. There are several factors that can actually cause an increase in PSA in blood. One is, of course, inflammation of this bladder. So when you have an inflamed bladder, what is happening to this pen? When you have an inflamed bladder, of course, and even the urethra, you will start affecting the integrity of the barrier that is supposed to actually preserve PSA into the prostate, and that can actually cause a leakage. Number two, urinary tract infections, the UTIs. Recurrent UTIs can actually bring a problem, and these can affect the barrier, and then you start having the leakage into the bloodstream. Also remember, there are drugs, there are techniques like surgeries. So let's say you have a partial removal of the prostate. You've actually already interfered with the process of the integrity of the prostate gland. So you are spilling it into the bloodstream, and that can cause an increase in PSA. Also, do not forget, some people, because the prostate is actually near the rectum, so some people who end up having anal sex all the time can increase their prostate, the PSA levels in blood. So therefore, stay away from anal sex. Multiple ejaculations and masturbation can increase this because they affect the integrity of the prostate. And I'm sure that most of the men have actually heard that if you either ejaculate every single time, every day, or frequently, you will reduce your levels of PSA or you reduce your chances of getting prostate cancer. That is not true. Multiple ejaculations will wear off the prostate gland. Therefore, PSA in blood will increase, and also risks of an enlarged prostate and an inflamed prostate, and also problems with the cancer can come in. So therefore, do not be lied to that multiple ejaculations will actually reduce your chances of getting prostate cancer. It's not true. Okay, so those are, and again, an enlarged prostate and prostate cancer are some of the, remember, cancer does not obey rules. So cancer will cause this alteration of this barrier and release the prostate into the blood. So you see, Most people who have cancer, actually people who have prostate cancer, they will have high PSA in blood, right? However, you can have high PSA in blood without having the cancer. So therefore, PSA is not an ultimate test to show you if you have prostate cancer, because if you have prostate cancer, we expect it to leak into the bloodstream. But if you don't have prostate cancer, we can still have an inflamed prostate, an inflamed urethra, UTIs that will cause leakage of the PSA into the bloodstream, and that is not prostate cancer. So this is basically what you should know about prostate cancer. So those are the factors that increase PSA in blood. However, what factors can actually cause a reduction in PSA in blood? Of course, healthy lifestyles, right? Because when you have healthy lifestyles, there's no UTI, there's no inflammation in the bladder or in the prostate, therefore PSA starts to go down. The integrity of the prostate gland is actually maintained, and because the body knows how to repair and heal, so therefore the integrity is maintained and PSA stays inside the prostate, and you will never suffer high prostate levels in the system. Okay, so that is what you have to do. And of course, there are some drugs like estrogen, synthetic estrogens, drugs like finasteride, they can actually also cause an increase in PSA in blood. So I thought you should know this. So anytime you find your PSA levels going up, you need more interventions. You don't start panicking thinking that this is actually causing you cancer. And I hope you can actually go back on this live and to just watch it and enjoy it to the fullest, so that you can actually understand an enlarged prostate, you can understand the PSA and how it functions, you can understand other parameters that can be used to diagnose prostate cancer, and above all, just know what to do to make sure that you live a healthy life and you maintain your reproductive health, specifically for those men who are above 65 years of age. I thought you should know this.